If you have recently started your orthodontic journey, that means you have put on dental braces, then this episode is for you. Hi, my name is Dr. Rudra Mohan and today I'm going to be talking about what all instructions you need to follow once you have recently started your braces treatment. Let's start. So today we are going to be talking about all the instructions you need to follow if you have just embarked on the orthodontic journey of braces. That means you've gotten dental braces done for whatever reasons. It could be because of malalignment of teeth leading to other problems, functional problems. At the same time, if you wanted to improve your smile. So there are some instructions you need to really religiously follow because you have embarked on this journey, and this journey is not as simple as it looks because it does require a little bit of sacrifice from you in the form of abstaining from certain amount of certain kind of foods, at the same time following some instructions very religiously. So usually the orthodontic treatment is started by placing separators, which can be painful, and I understand that that can cause pain and discomfort, for which you are given anti-inflammatory drugs and painkillers. After that, once you have started the bonding phase of your braces treatment, wherein you basically get the braces, the brackets basically bonded over your anterior teeth, usually we let them be there for about 3 weeks so that you can get used to it. So it might take some time for you to get used to it. That's why whatever bonding we do, we leave it at around 2 to 3 weeks so that you can probably get used to and accustomed to the feeling of something extra in your mouth. And we don't start the orthodontic movement or the wire and the traction and all those forces immediately, so that at least your mouth gets used to the fact that there is something extra in your oral cavity, which is actually something that you need to get used to. So there are a few rules that you need to really follow religiously, like whatever teeth that have been bonded, you're not going to use them to do the previous functions such as biting onto hard objects and all those things. What I mean by that is that the brackets that are bonded onto the teeth chemically are definitely susceptible to mechanical forces. So you have to avoid biting onto hard objects, crunchy objects, sticky objects from that side, because there might be a high likely chance that your braces, the brackets might come off, or one of the brackets might come off. There are some sacrifices you have to make in order for your treatment to be successful, such as some sort of dietary restrictions. You can't take hard food, you can't take crunchy food. Non-veg, you can't take something that is too fibrous. You have to either get it grilled and it has to be boneless so that it does not cause any abnormal flexuring of your teeth. At the same time, there's no fracture of the brackets or any of the brackets should come out. Also, when you're consuming dairy food containing cheese, you have to make sure that, especially when the cheese is hot, it becomes very sticky and molten, and there's a high likely chance that it will stick to the brackets and that can cause problems. Whatever bite size that you used to take before braces, it has to come down to morsels. I have to be very honest, you have to take small bits and pieces of food to eat, and eat it from the back teeth, which are actually meant for gnashing and all those things. After every meal, or after every morsel for that matter, if whatever you eat, let's say you have a small snack between meals, you have to, whatever small amount of meal that you're having, you need to make sure that you are rinsing your mouth with water, because these areas, basically when you've bonded the brackets, they also serve as niches for microorganisms and plaques. So you need to make sure that the area is very clean. Otherwise, you might get decay in the teeth when on the bonded surfaces. At the same time, you might get some gum problems. So once the orthodontic treatment has begun after the bonding, definitely they're going to start using the orthodontic forces, and that might cause a little discomfort when it comes to the movement of teeth. Obviously, your teeth are anchored into your bone, and obviously doing a movement requires some forces, and that would create some sort of pain and discomfort. You can take some over-the-counter medications and painkillers. However, I would like to remind you that always contact your orthodontist before taking the medication, and don't self-medicate. Always ask your orthodontist what medication you can take before you can go ahead with consuming the medicine. You can get dry mouth because of it, because your lip seal might not be complete because of the brackets in position. Therefore, you need to make sure that you keep on applying Vaseline very regularly. In case you do develop oral ulcers because of trauma or the friction that is being created because of the brackets, make sure you take a soothing gel as per the recommendation of your orthodontist and apply it regularly so that you can go about your day. What happens in such cases, if you don't follow these instructions, it will lead a lot of pain and discomfort. I'm being very honest and very brutally honest about this. What happens when it comes to non-compliance with orthodontic patients is, if you don't follow the instructions, first of all, your treatment is likely to fail. Secondly, if you don't follow the instructions, it's going to cause you more discomfort, thereby it will lead you to be more disinterested in the treatment, and therefore your non-compliance will increase, and then it's a vicious circle, and ultimately it might lead to the failure of the treatment. So basically the buck stops with you whenever you are planning to get orthodontic treatment and your bonding has started. These are the instructions you need to follow. And this was today's brief episode about the fact that what instructions you need to follow whenever your bonding is done. So please like, share and subscribe and spread the word, and please press the bell icon for important updates. If you want to do a WhatsApp consultation with me, my number is flashing, but make sure you message me first, because I might be busy with a patient or I might be busy otherwise. So this was today's episode. Like, share and subscribe. Thank you.